I've got Tom
Oh,
MacArthur.
dear.
I've got the representative right now, Tom MacArthur, who it was your compromise that made today possible. So very quickly, will the Senate adopt what you've proposed and what the House has passed, or is this going to be drastically changed?
Well, there's no way I can know that. I hope they do, because to get anything done that's lasting, it requires compromise. And if you think about this compromise, all we did was try to thread this needle of how do we protect the most vulnerable people who are going to lose their insurance if we don't fix this system, and how do we do that in a way that brings down premiums for everyone else?
But Democrats say, because we don't have the current CBO score, they're using the old one, that 24 million Americans will lose their health care. What do you say to the Democrats?
Well, look, the CBO score said that 24 million people might choose not to stay insured because the mandate is being lifted. That is no way to make people have insurance. And today we have 23 million people that have no insurance and pay a penalty or get a waiver to not have insurance. I think this bill, particularly now that we've addressed the cost issue, as costs come down, I expect far more people, especially young people, to buy insurance.
I know that Trish has a question for you. I'm going to have to relay it to the representative, Trish, because...
Fine. Yeah, no, I understand. He doesn't have an earpiece. I mean, as we talk about costs, you know, I think Jeffrey Sachs, the economist who was just on, was making a good point in that he does not think that this bill is doing enough to actually systematically reduce costs. In other words, he wants to see the government work aggressively to try and reduce costs so that they're out in front on the negotiation. Betsy McCoy, actually, this is a rare alliance where she was also making the point that we need to be doing more to negotiate, for example, better drug costs.
So what Trish is asking,
can we do, what else could be done as we try and move this forward now into the Senate to reduce the cost of health care overall?
So what more can be done now that it's on the Senate to reduce the overall cost of health care?
Well, we've addressed a lot of that. Good question, Trish. And it's a little like having a translator here in the middle. But we've done a lot to reduce health care costs by simply giving the states some flexibility in the individual market. And what we've done in Medicaid, which hasn't been the subject of as much discussion, but what we did in Medicaid was put pressure on the states and give the states an incentive to begin to bring down cost. That includes things like tort reform, like medical fee-for-service reform, which is a very costly way to run the system, bringing down the cost of drugs. Those are all things that can be addressed by the Senate, by the House. They can't all be done in this budget reconciliation bill, but those are the next step things that we have to address.
Very quick last question for you. Do you worry Mitch McConnell may let this thing, one senator's already said dead on arrival, and just let it kind of disappear?
Well, I focus on what I can influence and what I can control, and I have zero influence over what the Senate does. We've sent them a good bill. It was a good bill when it came out of committee, but it's better now. It's stronger, and I feel confident they will certainly consider our bill.
All right, Tom MacArthur, thank you very much. Trish, back to you.